introduce yourself and tell us a little about you.
My name's Chuck Pavano, 56 years old. I've been a diabetic for almost 15, 16 years. I've been drawing since I was a kid. I went to school and I became a mechanical designer. You ever go into a factory and you see all the pipes running in the ceilings? And I design all that. I've been working for my present company for the past 11 years. Within 6 months when I started there, I had to get a valve replacement done. After the surgery, they noticed my blood sugars were high. I gained 100 pounds in 3 months.
If you had 100 employees, usually there's 5 employees that are driving 50% of the healthcare costs for that company. It often is because of a navigation issue.
I have to see doctors. I see cardiologists, I see my primary, and it's on a constant basis. There's a lot of engagement in the healthcare system to try to get everything under control.
There's so many things a patient with diabetes has to do. Obviously, seeing your primary care physician, possibly your endocrinologist, a nephrologist, a cardiologist, a podiatrist, a dietitian. One of the biggest challenges in healthcare is just navigating through and access and knowing what you should do at what time. Who should I call? What if I have this question? How do I get these questions answered?
I'm good at multitasking, but I get tired. With my insurance, Parkview Signature Care, they hooked me up with a coordinator.
When I first met Chuck, his health wasn't in the best. He was going through a lot of different things with his diabetes. I had reached out to him and he's like, actually, I do need help. He's like, I've got all this stuff that I need to try and get figured out, and I don't even know where to begin.
A nurse coordinator helped me with all my doctors I was going to, and if I needed anything, she took care of that.
Care coordination is meeting the patient where they are and helping them understand the medical system and then getting them to the right places.
So think of a care coordinator as somebody who's going to come alongside of you that understands what you're going through and helps navigate and execute that care plan.
I had a procedure done. I told Stephanie about it. I had an appointment within a week. And she would call me every month to see if there's anything I could do, and we became friends.
When I seen that he was on my schedule for the day, I was just like, oh, it's gonna be a good afternoon. He was always able to make me laugh.
The past year, since my health has been very good, she was able not to do it anymore.
You know, I hadn't worked with him in a while because his health was so good, and I had touched base with him. It really melted my heart because I was still in his phone as Nurse Stephanie.
Nurse Stephanie, Parkview Care Team. That's how I tell you. I will always be a diabetic. It's not uncontrolled anymore like it used to be. It's controlled. Before I dealt with Nurse Stephanie, my A1C was high 9s, low 10s. I looked the other day, I'm down to 6.8. Since I got my sugars under control, I don't have to go to the doctor as often.
The most exciting thing is seeing the results that are coming in from a lot of these innovations. And so when I can see, numbers that we go from 20% of patients with diabetes controlled at an employer to 70 or 80%. That just, as a clinician, that just, again, melts my heart. A very nice benefit of that is it's about $2,000 less per year to take care of a patient who has controlled diabetes versus uncontrolled diabetes. I think of that as a byproduct, a great byproduct, but it's really about delivering higher quality care to a community or to a group of employees. And clinically, the patient is so much better and leads a more productive and happier life.
My wife, she says, why don't you start drawing again? All right, so I started this little corner in the living room. I'm like, let me try something different. Let me try airbrushing. I'm constantly busy. I come home from work at 2. I'm working in my studio till about 5 or 6.
He's the one doing the work. I was the support. I just helped kind of guide in the right direction.
I remember faces more than I remember names, except for Nurse Stephanie. I can never forget Nurse Stephanie because she was always there for me. The Holy Lord must have sent me here all for a reason and put me in with the great doctors at Parkview because they saved my life.
Knowing that you've helped somebody and you've extended their life and you know that they are grateful for what you've done to help them, that's enough to fill your bucket and to keep going.